This Mother's Day, we're getting more insight into the racial health disparities that are causing high death rates among Black mothers and their babies. Lawmakers and women testified at a House Oversight Committee hearing earlier this week. There are several proposed bills to help decrease the death rate, including implicit bias training for doctors and funding for prenatal and postpartum care. According to the CDC, nearly 42% of the women who died from pregnancy complications between 2014 and 2017 were Black. 15% of those deaths were caused by cardiovascular conditions. Sonia Young-Adam joins us now to talk more about racial health disparities. She runs the California Black Women's Health Project, which works to improve health care for Black women and girls in California. So, Sonia, thank you for joining us tonight.
Thank you so much for having me. I appreciate it.
And happy Mother's Day to you. This is a very appropriate topic to talk about today. Let's talk about some of these health disparities that Black women face, especially if they're pregnant. What are they?
Well, unfortunately, we are in a state of crisis that we've actually been in, since the time of Black women coming to this country. So we talk about the disparities as if they are new. However, I want to emphasize that these are not new disparities. If anything, the disparities continue to persist, even though we see conditions for birthing in the country getting better. But for Black women in particular, sadly, what we see is that Black women are 3 to 4 times more likely to die in childbirth from pregnancy-related causes than white women. And then even more sadly, the death rate of Black babies is twice that of what you see for white babies. At this point, we are just, fortunate to see that the nation is beginning to, look at these issues and challenges. But those disparities exist across, economic factors for Black women. They exist across educational factors and all of the things that we would normally consider protective factors. We still see those gross disparities that really are unacceptable because they're equivalent to what you'd see in, third world countries or, other parts of the world where we don't have, the greatest healthcare system that we do here in the United States.
Congresswoman Cori Bush testified about her own experience when she was pregnant. Let's play that sound, then we'll get your response on the other side.
I told her that I was having severe pains, and she said, "Oh, no, you're fine. You're fine. Go home, and I'll see you next time." So that's what I did. I went home. 1 week later, I went into preterm labor. At 23 weeks, my son was born, 1 pound, 3 ounces.
Your reaction to that testimony?
The Congresswoman's experience is not vastly different from what we hear all too frequently, that is happening to Black women. When she specifically talked about her doctor saying, "You're okay, go home," and the doctor not fully acknowledging the pain she was experiencing or the discomfort or some difficulty or even some anxiety about what she was experiencing. That is what happens far too often for Black women in the birthing experience. And what happens is that we're either told that, we're either exaggerating or, if we are expressing, a level of pain that, is disbelieved, we're told that we're the drug seekers or we're just merely discounted and dismissed. And so for the Congresswoman to articulate that, so passionately about, what happened to her, and she mentioned that happened 20 years ago. And so when we think about something like that, it wasn't just what was going on 20 years, it was, decades and, centuries before that. But to know that in this day and age that, we still have stories like that are being told by Black women, it's unconscionable. But there has been a collective cry out, from communities.
So what advice would you give expectant mothers who are concerned about receiving the proper care?
One piece of advice we give is never go alone. Never go to a perinatal visit alone. Always take somebody there who can contribute to, asking questions, who has a listening ear, who can nudge and advise and, step in if necessary. Also, to find a sister circle. We refer to them as a sister circle, a gathering or a collection of other Black women, like-minded, who are experiencing, are preparing to experience birth, and utilize that kind of a space, to listen and to learn and to ask questions. We also train Black women, and we encourage Black women to seek out training around advocacy and how to advocate for yourself, how to feel empowered to go in a space and to, request and then, if necessary, demand the type of care that we should experience. And then to seek out Black birth workers. There are a number of doulas and groups of birth workers that come together to help Black women to experience a joyous and a safe birth.
We will leave it there. Again, happy Mother's Day to you, and thank you for joining us to talk about this very important topic. We appreciate having you.
Thank you so much. I appreciate being a part of this discussion. Thank you.